Hello, my name is Caitlin Davis, and I'll be presenting an informational slideshow regarding the emotional impact of COVID 19. COVID 19 is caused by a virus named SARS CoV 2, which was identified in China around the time of the coronavirus outbreak in Wuhan, China. This virus is related to both SARS and MERS, also known as severe acute respiratory syndrome and Middle Eastern respiratory syndrome, respectively. According to the Centers of Disease Control and Prevention, coronavirus, also known as COVID 19, is spread through water droplets entering the air when someone sneezes or speaks. Although there are a variety of symptoms, people can be asymptomatic, meaning they show no symptoms. General regulations to reduce or prevent the spread of COVID 19 include wearing masks in public, social distancing with at least 6 feet of space between yourself and people that weren't in your household, routine hand washing with soap and warm water for at least 20 seconds, and general isolation in some areas. An example of this would be the lockdown and curfew that took place in the state of New York in March 2020. This video will explain the effects the COVID 19 pandemic has on people mentally, as well as how to cope with the impact of these effects.
Coronavirus obviously has created a global state of uncertainty.
I think we're going to be having a mental health crisis now.
COVID-19 can be characterized as a pandemic.
Normality, as it was before, will not come back full on until we get a vaccine for this.
It's important to recognize both the immediate and the long-term impacts that this pandemic can have on people's mental health.
There are different phases of mental health distress that one experiences at different points in a pandemic. The other differences that probably distinguish it from other disasters would be the level of self-isolation, physical distancing, travel restrictions. Hi, I'm Dr. Sanjeev Sokalingam, a psychiatrist and vice president at the Center for Addiction and Mental Health.
It starts with a fever and feels like the flu.
A mystery illness known as severe acute respiratory syndrome, or SARS.
During SARS, we saw kind of initial rates of general psychological distress that exceeded amounts that we would normally expect, emergence of depression, anxiety early on. And in individuals that were involved, we also see persistence of some of those symptoms after SARS.
Let's get out of here.
If we go to other disasters like 9/11, for example, is a kind of disaster that was abrupt, I think it's different in the sense of what we're seeing right now. Those who were closest to it, who had losses, who were involved as first responders, were more likely to suffer post-traumatic stress disorder symptoms, depression, anxiety, and distress. And we do have studies that are, decades later that still show that there are some residual effects for some individuals. And I suspect that for many people, they're going to need support beyond COVID-19.
Looking after your mental health is, of course, as important as taking care of your physical health.
The most common things we're going to notice are going to be tied to anxiety and mood disorders. Hi, my name is Dr. Rayman Abdurrahman. I'm a clinical and consulting psychologist with an expert on anxiety and trauma. So here are my top tips on how to cope. Number one, and this is the biggest one of all, stay in contact with other people. The biggest thing that we are missing is contact with the people that we care about, our coworkers. A good old-fashioned phone call, being in touch with social media is number one. Number two, we want to manage the amount of information coming in. We need to be informed.
The World Health Organization is now calling the global coronavirus outbreak a pandemic.
The news is tough, the predictions blunt.
But we don't need to be inundated with a lot of this information. So limit your access to the news. Set a time where you can actually touch base and find out what you need to, and then carry on with your regular day. Number three, have a regular routine as close as possible. It won't be what you're used to, but set a routine as much as you can. And so my next point is ultimately about learning to be okay with things not being perfect. We have to revisit what it means to be professional. We won't be as productive we want to have this balance between, being active and busy, but not overdoing it to the point that we're stressing ourselves out. Behind that need to be productive is this fear that somehow our sense of self-worth is tied to producing a lot. What matters most is that we get through this with a sound state of mind and a healthy state of well-being. We need to change our thoughts from the what if to the now what. That gives us some sense of control. The more we're able to write them down, that will give us greater control over things instead of just looping them through in our heads. And if our anxiety gets to a physical level of panic, and that might be the case for many people, watch how we breathe. What we might not be realizing it is our body might be prepping for an alarm system. Start to breathe from your nose in a calm and relaxed way. There's a lot of videos on YouTube on relaxed breathing. That's also a good way to stay calm. And last but not least, there's a lot of mental health providers who are providing phone consultation or video consultation. Accept that. There's a lot of organizations around the world, actually, that are now producing free access to health resources about how to manage mental health in this time. Look for them. Follow those tips. That's one of the best things you can do.
The Anxiety and Depression Association of America found that anxiety disorders are the most common mental illnesses in the United States, affecting 40 million adults, or 18.1% of the population every year. Anxiety disorders can arise from a variety of risk factors such as genetics, life events, and brain chemistry. Taking this into account, it isn't surprising that such a large event like a pandemic could increase the number of people experiencing symptoms of anxiety. Out of these people with anxiety disorders, it's not uncommon for those suffering from depression to also suffer from some form of anxiety. About a half of people diagnosed with depression are also diagnosed with anxiety, meaning they can essentially go hand in hand. Those between 18 and 29 years of age had the largest increase in people with symptoms of depression and or anxiety. In this graph created with data from the Centers of Disease Control, the National Center of Health Statistics, and the United States Census Bureau, you can see that each colored section has increased across all three categories as time progressed. Out of these three categories, you can see that the number of those showing symptoms of both depression and anxiety has always been higher than those that only showed symptoms for depression or anxiety, regardless of the time period. This graph from Chapman University resulted from a survey with a little over 4,000 randomly selected qualifying individuals online. Over the three categories that cover feeling depressed, anxious, or stressed, the largest numbers in each of these sections said that they feel those things are more than normal. 45% of the people surveyed feel depressed, 60% feel anxious, and 61% are stressed during the pandemic. Social distancing rules led to job loss and or significant loss of income. Job loss as well as isolation are associated with increased depression, anxiety, stress, etc. Some citizens are neither going to work nor going on outings. Both the loss of income and a lack of a safe social life contributes to one's stress. Minorities with inadequate access to healthy food, safe housing, and health care can increase their stress levels, potentially affecting their mental and physical health. For example, Hispanic adults reported a higher commonness of stress related to not having enough food or stable housing. 53% of households with job loss or lower incomes report symptoms of mental illness, while 32% of households without a job loss report symptoms of mental illness. Since the pandemic began, there's been a rise in racially motivated attacks against people in the Asian community. 32% of Asian Americans and 38% of Chinese Americans reported that they experienced at least one incident of racism while 25% of Chinese Americans surveyed experienced 3 or more racist incidents. The Black community, the hardest hit group by COVID-19, were the next group behind Asian Americans to report at least one racist incident, while 21% reported 3 or more. Among these two groups, these experiences were linked to depression, anxiety, greater stress, and loneliness. Because of the pandemic causing such drastic changes in what used to be our normal life, more people started reaching out for treatment in 2020. Compared to the previous year, 2019, the number of people going in to treat adjustment disorder increased by 15%. Adjustment disorder is a disorder diagnosed when someone responds to a stressful life event with depression and anxiety symptoms. Visits pertaining to substance abuse went up 51%, and visits pertaining to anxiety went up 12%. Catherine Erickson Riddell, a psychiatrist working with Kaiser Permanente in Northern California, stated that the increases in patients seeking treatment are consistent with other data showing that stay-at-home orders in the pandemic had been difficult for many people. Because it implemented social distancing guidelines, telephone and video visits increased by 264% compared to 2019. However, the switch to a virtual format resulted in 42% less visits from new patients. This and the following slide are my works cited.